I think we're all a little COVID messaging weary, but it is a good opportunity to be able to share how we've been dealing with this, how we're doing, where we are and where we're going, and some of the unique challenges, not just to us as the Knolls, but to a lot of the other retirement communities as well. So I am going to go ahead and share my screen. So bear with me here. And sort of take us through, hang on one second. Just a little visual for interest, but I want to talk about a few things that, and how we're going to do this is I'm going to go ahead and just give us a brief presentation, and then Laura will open up for questions, which I'm sure you might have some. So we'll both try to answer those as best we can. So most of you know us, most of you know the Knolls, but in order to speak about some of these specific things, I just want to do a really brief, like 30-second history, a little bit of context, so we can put this all into place and understand. Many of you know where we come from is Maple Knoll Community, which was established in 1848 through the merging of 3 different charities. Fast forward to 2000, that expanded here to Oxford as the Knolls of Oxford, after much work by a lot of local interested citizens, many of whom are, still with us and still leading. A few years later, we were able to add the Commons, which includes our assisted and skilled wings. And a few years after that, 2 years after that, we were able to enter into a formal affiliation with Miami University. We're actually one of the first continuing care retirement communities to do that in the country. And we have both benefited greatly from that. And then finally, 2010, we were recognized as a certified continuing care retirement community. So that's just a brief, very, very brief foundational history, so you know who we are as the Knolls. It's also important to this discussion to understand our governance, our oversight. We and all of these types of communities in Ohio are overseen by the Ohio Department of Health. They, once a year-ish, under normal circumstances, send out surveyors. It's kind of like an audit in banking terms, coming to make sure we are following regulation, that everyone here is well taken care of, and they will speak to residents, they will look through our records, it's their job. That has changed a bit since COVID. There are now infectious disease surveys that are random to make sure we are abiding by those regulations. So we take our directives from the Ohio Department of Health. Also, the federal branch of that, Centers for Medicare and Medicaid Services, since most nursing homes in Ohio do receive money from them as well. So we are governed by their mandates as well. And then finally, which we've seen a lot of this year, any executive orders come. We could not go between assisted living and skilled nursing, which made it extremely difficult for those who have a spouse in assisted, a spouse in skilled. There were all these new complications that were, unanticipated. I don't want to say entirely unanticipated, but I think it's fair to say that often those making the policies are not the ones doing the hands-on, enacting of these new rules. And so there would just be these complications and these roadblocks that we had not anticipated. In this area, of course, just being the connection with family, the connection with other people, connection with their friends, all of our social activities came to a screeching halt. As I was making this up, I was trying to remember our last actual main gathering, and the only one I can remember is right before it all shut down. We had our last art gallery opening, which we do about every 3 months, and that's it, the last one I can remember, and then it all shut down, and it's been very quiet in this building for the last 9 months. So social activities come to a screeching halt. That doesn't mean we didn't attempt to continue what we could within a hall or within the rooms when they were quarantined in the rooms, and we'll talk more about that later. And of course, dining, group dining was also eliminated. It's a little easier for those in the cottages who have their own kitchens and their own families that could still come to see them if they chose. Difficult for those who rely on the dining rooms and the dining areas here in the buildings. This building, anything within this building was our primary concern, as well as our independent living residents, of course, but most people were extremely understanding, extremely patient, and understanding that we had to abide. Health monitoring, prevention and monitoring. This was brand new for everybody. what now seems very routine. We had to set up a screening station, which brought all of our entrances down to just one for employees coming in and out and visitors. Screening station where, of course, your temperature was taken and you were asked the screening questions. We still have that today. Actually, we have now advanced to their automatic screening stations so that you don't need a person doing it anymore. You answer the questions on the screen. It takes your temperature, it screens you, takes your temperature, and prints out these neat little badges that say, if a surveyor were to come in, that says Cheryl was screened this morning at this time. And those are the types of things that they would look for. PPE, we're kind of tired of hearing this word or this acronym, but the masks and the hand sanitizer, and back in the skilled units, of course, all the gowns and whatever it is that they may need to make safe their interactions. Luckily, we have an infectious disease specialist who is very assertive about pursuing any opportunity that came up from the state or from the county for grants or for donations. So we were very well equipped considering the shortages that were out there. We were very fortunate to have so many people contributing to just that one area. Testing, this may be one, I don't know if many people know this about the Knolls and of course other nursing homes throughout the state. In early July, it was mandated that we begin regular testing of all employees based on your county's percentage levels. So when we first started, and Laura can correct me, I think it was once a week. Might have started
twice a month, I think, in the very.
Oh, it was every other week. So we started every other week, which we were just horrified about, because included in that testing was an enormous amount of data entry that the state required on every single employee. And the beauty of it, which I say that sarcastically, is none of that saved anytime, anywhere. So, and every other week we had to re-enter an enormous amount of information for every single employee. Here at the Knolls, it's about 150. We have been, as our percentages have risen, we have been testing twice a week for months. Is it months, Laura?
Yes, months.
Months. And it's the nasal testing. It's not the swab in the mouth. But a lot of people are surprised to hear that, that we have been testing twice a week for a long, long time. It's kind of common now. We go in, today was a testing day, you come into work, you check in, you go get your nose swab, and then you come back out.
Yeah, as long as Butler County is over 10%, we have to test twice a week.
And we're still quite high, so we anticipate that'll be for a while. If there is a positive among staff members, then that launches a resident test. And by resident, I mean up here in the building, skilled nursing and assisted living. So they've been tested for a week, every week for a while as well. Things even back in the beginning, like mail and package delivery, all of these changes, there was no mail brought to the building anymore. Everything had to go through the Commons entrance. There was a while back, if you remember, it was pretty early on, they thought that the germ might live on surfaces for up to 24 hours. So we had just piles of stuff hibernating, for a day or two before we could actually deliver it to the residents. So it was a lot of change, a lot of very quick change. And hopefully it did the good that it was meant to do, but these are just some of the sort of the behind the scenes challenges we have faced. Communication protocols was very intense for a while because the state, rightly so, wants to make sure that families and residents are being informed and properly informed. So in the beginning there, I remember several days where we all spent the day on the phone, calling family members for every policy change. And finally, they were able to allow us to create a COVID webpage that was deemed an acceptable means of communication, and making sure that we sent out communication to the family saying, hey, everything from this point is going to be on this webpage or on this app, which we had been working on before COVID, but a mobile app for residents, for family members, and also for employees that would get that message out very quick if there was a last minute announcement, which there often are. Any testing changes, any positives, everything has to be announced within 24 hours. So this has been a godsend. And I put signage in there because this is sort of it's a little humorous to me. The signage that the state requires to make sure that everybody knows what they need to know is actually comical, in my opinion. The dock area where we all come in, it's just plastered with signs. Every new policy and every new change is, and you try to make it as appealing, you know, to the eyes you can, so the signs get bigger and they get more colorful, and we put people on it. It's actually comical. So, you know, we're doing everything we can possibly do, but some of it has a little bit of levity to it as well. So those are the three primary areas that we saw that we had to adapt to very quickly. As far as operational, I want to make sure that I'm not making it seem that we were not concerned about the medical aspect of it as well, of course. But in order to best address that, these were the ways that we went about doing that. As you can imagine, budget. This has been, I probably should have talked to our CFO before this just to see what his take was, because I can't even fathom the changes that our accounting offices have had to make. As you can imagine, when this hit, our occupancy, it came to a screeching halt. Anything that we had open stayed open for a lot longer than it normally did, because very understandable, people don't want to move during a pandemic. There was a lot of uncertainty, a lot of things we did not know. Things did start to pick up in independent living there, and maybe June slowly start the wheels going again. Assisted living, I'd say, has suffered the worst. This is the area where, you know, to go from independent living into an assisted living situation, knowing that when you come in, you will not be seeing your family indefinitely. You will be quarantined for 14 days, and any other positives that come about. So marketing wise, and that's my job here, I should have probably said that right up front, I'm the marketing manager. This was a big screeching halt for us. Employment, as you know, many of the other companies and many businesses in the area, that there was mass exodus. There was just nothing that they could do but lay off their employees for the time being. And for a while there was, you know, assistance with that. But we are very proud of the fact that we never did lay off a single person. Even those that had no job to do anymore, our housekeepers couldn't go out into the cottages. So we redirected their duties, and we had them screen the check-in, help serve, whatever there was that needed to be done, we were able to redirect. And the other thing that we are really, really proud of is many of our employees, as you can imagine, have children. Their childcare options disappeared. Daycares closed. Elderly relatives who were watching the children didn't feel safe doing that. Schools closed. So probably one of the biggest changes, at least for our campus, our clubhouse turned into a childcare center. And our social director and our assistant social director really deserve a medal. They became childcare providers for 3 months, Laura, more maybe. And that was 100% free of charge for our employees. We were able to provide that for them. We were able to do so with meals as well. If we wouldn't allow our employees to leave once they checked in, so they couldn't leave for lunch just to reduce exposure. Therefore, we made all lunches free for all employees throughout the entire pandemic. So some of those behind the scenes things, which you can imagine impacted the budget quite a bit. Materials, we were kind of joking about this yesterday, which seems like a million years ago. Laura's office was kind of the holding cell for toilet paper for a couple months, and all those coveted items, because, you know, people were trying to find them everywhere and nobody would dare go up against Laura. So we just thought her office would be the best place for this. Services, with dining gone, it was delivery every day. We've been doing a free meal Friday for 9 months now. Like I said, we provided for our employees. We had to adapt in here as well for the dining halls for our residents. It's just been a lot of required flexibility, and those services, even housekeeping, we were unable to do. So we would deliver housekeeping materials to the independent living if they chose, so that no one would have to go out. We helped assist with the click list, so people would learn how to use that very quickly, so they can have, you know, groceries delivered. Just an ongoing flow of new things. And then, as I mentioned, the testing has been an entirely new component of our place here. We had to hire a team. Once we started going once a week and then twice a week, we actually had to hire 3 full-time people now that do the administrative, do the what would you call that? What Joni does, the
actual
labels and all that.
Testing the labels, yes.
And then of course we need a nurse to actually do the swabbing. So they are our infectious control team for here and Maple. No, they're 4 and 5 days a week. That's all they do. So not only do we not lay people off, we actually ended up hiring a couple more. But financially, those are the main areas that I think not just the Knolls, but a lot of places have been.
I think people don't realize how expensive testing is. Testing is $85 every person twice a week. That's how much we test. And like Cheryl mentioned, we test between 120 and 140 people every week.
Yeah,
so.
Times 85, times 2, times 9 months. So it's and we are self-insured. It's been expensive. So I'm actually kind of shocked. I thought for sure they'd say no more, but where we work, it's obviously it's a requirement. And then for morale, these are just some things we've been doing. As you know, and I didn't focus a lot of time on this, we've read every article about the dangers of extended isolation and not being, the side effects of not being connected to your family. And we are aware, especially this demographic, who really rely on that. Those with cognitive issues, how difficult this is on them, the separation and the time that has gone between. So, in all of our areas, in independent living, in assisted, in skilled, we've tried to just keep spirits up with things like, gift and snack bags on a regular basis, crosswords, puzzles, crafts, each to the room, and it gives us an opportunity to check on everybody, make sure everybody's doing well as well. We have friendly little competitions. I think out in Independent, we had the Olympics, and then what was the other thing, Laura? The state fair. There they kind of, run in flower arrangements for a competition, and just different things like that. Up here as well, we had a fun little Christmas decoration competition among the halls and kind of involved the residents, and just something to distract, to stimulate. There are only so many puzzles you can do, The community has been phenomenal sending cards. We're still getting cards from the community to give to our residents, just to ease the loneliness a little bit, to touch base, let them know they're thinking of them. Food, I talked a lot about that, but food has been a big part of this. Even with the employees, we have many appreciation lunches. We've had donors from the community send food, just trying to keep everybody's spirits up and going, and just little games and little contests for employee appreciation and highlights. So none of those are earth-shattering, but this many months in, it's those little things that really do seem to bring a little light to the darkness, so to speak. And this is where we find ourselves today. This is the fatigue, what I call the COVID communication fatigue. We've all heard every possible message that there is to hear about how to safeguard ourselves and the loved ones. And we've often felt the frustration of feeling like just when we've reached one goal, something else happens and moves those goalposts back. We were opening up a little bit in the summer, had some 10 people or less for some of our balance classes or the dining hall, and then the second wave hit and kind of brings it all back again. We are experiencing what we call vaccine impatience right now. We see that light at the end of the tunnel, and this is like kind of what we've been waiting on when the vaccine arrives. But we're being told, well, things aren't really going to change. You're going to get the vaccine, and they'll change eventually, but they're not really going to change right now. Kind of moving that goalpost again. Laura's been fielding calls day and night about when do we get the vaccine. And this is where my message desensitization comes in. I think, and understandably so, our residents and families are at the point where they're kind of getting tired of us saying, we don't know. When the state tells us, we will tell you. Poor Laura, somebody was accused of hoarding vaccines. I can't remember who we were talking to the other day. There's been anger, there's been accusation, they were saving them or hoarding them, and honestly, we've never even touched one. It's completely up to the pharmacy how that works, and it's been going smoothly. We've had our first round here in skilled nursing and staff who took it. Second round's coming end of January, and we are expecting more guidance. I think tomorrow there's supposed to be a release of where locations will be for 80 and up and 70 and up, that type of thing. So it's getting to the end and hanging in there. We do see that light at the end of the tunnel, and we're hopeful. We are grateful for the community that has been been so supportive, and for families and residents who have been so understanding given the very difficult situation. But in a nutshell, those are our unique challenges, and maybe we'll write a book one day, Laura. Make some money off of this. And that's about it as far as informational. What questions do you have?